everyone, welcome to our channel INFODONTIcs. Myself Dr. Anne Maria, and in this video I'll be giving a brief introduction on obturation. So what is obturation? It is a method used to fill and seal a cleaned and shaped root canal using a root canal sealer and a core filling material. Why is it done? It is done to prevent the growth and multiplication of microorganisms in the canal. Sealers. These are binding agents used to fill up the gap between root canal walls and the core material. Core material. These are materials used to fill the center of a root canal. Now coming to properties of an ideal sealer. They should have good adhesion with dentin, should be radiopaque, with no shrinkage and form a tight seal. They should mix easily, should not stain, should be tissue tolerant, insoluble in tissue fluids and soluble in a common solvent. Now let's see different types of sealers. Zinc oxide eugenol based sealers. They are the most commonly used sealers in the clinics. But once they set, they become weak and porous. They are also cytotoxic and susceptible to decomposition in tissue fluids. Calcium hydroxide based sealers. They preserve the vitality of the pulp stem and stimulate healing and hard tissue formation at the apex. But calcium hydroxide is soluble and may leach out, leading to failure of obturation. Resin based sealers. They have good sealing, adhesive properties and antibacterial action, but they may produce an initial severe inflammatory reaction which may subside after a few weeks. They also have strong allergic and mutagenic potential. Silicon-based sealers. Although these sealers have a good sealing ability and excellent biocompatibility, it is stated that these sealers expand slightly on setting. Glass ionomer cement-based sealers. They enable adhesion between core material and the canal wall, but it's difficult to condition the apical and the middle third of the canal to receive the glass ionomer sealer. And also, these sealers are difficult to be removed if retreatment is required and has minimal antibacterial activity. Bioceramic sealers. They show most of the properties of an ideal sealer. They are non-toxic, bactericidal, dimensionally stable, can be removed easily, hydrophilic, non-resorbable, easy to mix and handle, and have adequate working time. So if you ask me which sealer should be used, it depends upon the case and the clinician's skill. Having said that, bioceramics are the most preferred. Types of core materials. Let's begin with silicones. They can be easily negotiated in small canals and are commonly used in calcified, round and tapered canals. It is useful in bypassing ledge or broken hand instruments and are dimensionally stable. But they don't provide a proper seal and leaves too much gap to be filled by the sealer, thereby increasing the chances of microleakage and irritation to periapical tissues. Gutta-percha. It is easily sterilizable, compactable, plastic, less toxic and radiopaque, but it lacks rigidity and can be easily displaced by pressure. It lacks adhesiveness and has limited shelf life. Resilin. They are introduced as alternative to gutta-percha. With resilin, the sealer bonds to both the canal and the resilin core. It shows less coronal leakage when compared to gutta-percha, more resistant to fracture and are biocompatible. Now coming to sealer application. Before explaining the procedure, let me tell you how much sealer should be applied for an adequate seal. Excessive sealer results in inadequate flow of gutta-percha as well as lack of gutta-percha at the apex. Here comes the concept of minimal sealer interface, which states that only a thin lining of sealer is essential. There are different methods for placing sealer, and in this video I'll be explaining the method using master cone. Initially, the canal is completely dried using paper point. Master cone with a proper apical fit till the working length is selected. It is then coated with sealer and inserted into the canal. Make sure that you doesn't go past the working length. The cone is then moved up and down in a pumping action to coat the sealer along the canal walls. After repeated coating, you will find some sealer on the cone that ensures adequate sealer thickness. With this, I am ending this video, and in next video we'll discuss on obturation techniques. So stay tuned. Thank you.